Do you know that there are conditions when babies are born with most of the abdominal organs outside the tummy? It sounds shocking, right? Yes, I know. Relax. It happens. And why you're as confused as I was when I first heard about it, let me explain. This condition is known as omphalocele, and this is a rare congenital abnormality present at birth. Today, we are going to talk about the causes, the signs and symptoms, the diagnosis, and then probably the treatment.
Oh my God! Wow!
Now, let's dive into the topic. What is omphalocele? Omphalocele, like I've said, is a rare congenital abnormality that occurs when a baby is born with most of the abdominal organs outside the tummy through the belly button. For more detailed understanding, this is a condition that occurs when a baby is born with most of his or her abdominal organs, such as the liver, the spleen, the intestine, and then most times the stomach. When these organs are being seen outside the tummy, when these organs are being protruded outside the abdominal wall and are being covered by a thin transparent scan, this condition usually occurs when there is abnormalities in a fetal development while in pregnancies. Now, let's move over to the causes of this condition. There are so many causes of this condition, where we have the genetic syndromes, we have chromosomal abnormalities, we have abnormalities in fetal development while in pregnancy, and then sometimes there are some certain environmental factors that can also be a cause to this condition. Then let's talk about the risk factors of this condition. That is the babies that are more likely to have this omphalocele. The babies that are more likely to have this condition, number one is the babies whose mothers are advanced in age. This is where we have mothers advanced mothers age, mothers up to 45 years and above. Number two is that this is where we have alcohol use in pregnancy, we have drug use in pregnancy, we have smoking in pregnancy, and then most times some medicines too can cause this condition. Then let's talk about the associated conditions with omphalocele. This is condition that maybe that might occur as a result of this baby having this omphalocele already, and this is conditions like the heart diseases, you have the neural tube defects, you have trisomy 13, trisomy 18, and then so on and so forth. Then let's talk about the types of omphalocele that we have. There are two types of omphalocele. This is where we have the small omphalocele and then the giant omphalocele. Talking about the small omphalocele, this is where parts of the intestines alone might protrude through the abdominal wall, and this is very, very easy to repair. Then talking about the giant omphalocele, this is when several organs are seen being bulged out through the abdominal wall outside the tummy, and this is very difficult to repair. Then let's talk about the clinical features of this condition. That is the signs and symptoms of these conditions. The number one signs of this condition is a visible sac containing these organs. Number two is that there might be a feeding problem, there might be difficulties in breathing, and then most times there might be injury to the intestine. Then let's talk about the diagnosis of this condition. Actually, it can be diagnosed while in pregnancy and after birth. While in pregnancy, it can be diagnosed through ultrasound. It can be diagnosed when there is elevated maternal serum alpha fetoprotein. It can be diagnosed immediately after birth through physical examination. And let's talk about the immediate care given to a baby. Immediately a baby is being noticed after birth of this condition. The care given as a healthcare professional is that you have to provide warmth for this baby. You give IV fluid, you cover the sac with sterile dressing, you protect the baby from infection. Then let's talk about the pre-operative and the post-operative care given to this baby. That is the care given before and after surgery. Talking about the pre-operative, this is similar to the immediate care given, where we give IV fluid, providing warmth, covering the sac with a moist and a sterile dressing, and then so on and so forth. Then talking about the post-operative, that is the care given after surgery. This includes checking for breathing, managing pain. You have to monitor this baby closely, you have to encourage fluid, or you give IV fluid, and you have to introduce feeding gradually. Then let's talk about the complications of this condition. If left untreated, there are several complications, such as there might be rupture of the sac, there might be infection, there might be pain, there might be feeding problem, there might be difficulty in breathing, and so on and so forth. Then let's talk about the treatment of this condition. The main treatment of this condition is known as surgery, and there are two types of surgery for this condition, where we have the primary repair and then the staged repair. Talking about the primary repair, this is done when there is a small defect. Then talking about the staged repair, these are repairs that are done in gradual processes, and this takes time more than the primary repair. Let's talk about the preventions of this condition. Actually, there is no guaranteed prevention for this condition, but there are some certain risk factors that needs to be reduced. That might include you have to encourage the mothers to quit smoking, to quit alcohol use, and then encourage them to take more folic acid. You have to encourage regular antenatal care, more of regular ultrasound, and so on and so forth. And actually, omphalocele is a threatening condition, but early diagnosis, proper neonatal care, and then surgeries can save the life of many babies. And awareness and proper antenatal care is very, very important in order to prevent this condition. At this point, they have come to the end of this lesson, and I hope you learned something new. And don't forget to like, share, and follow Anita for more headsets. Bye. See you again in my next video.